Hello everybody. Welcome back to another Anatomy and Physiology live stream. You guys are all awesome. Hello. It's nice to see you all. You guys are fantastic. Thank you guys so much for being here today. Happy Saturday. We're going to be doing some anatomy and physiology today. We have some musculoskeletal questions, some pharmacology, and some cardiology. With some cardiovascular system and some cardiovascular pharmacology. So we'll go through these questions and then we'll get explanations as to why these answers are right and why these answers are wrong. I'm just going to go ahead and let a couple people get in here first before we go ahead and get started here. But hello everybody, happy Saturday. How's everyone doing? I hope you guys are having a great weekend. Hello. It's good to see you guys again. Hello, happy Saturday. Hello, how's everyone doing? Hello, thank you guys for joining today. I would appreciate it if you guys gave the live stream a like. The more that you guys do like and share the live, the more that this will push this out to as many people. So we can help as many people as possible in anatomy and physiology, a little bit in pharmacology and whatnot. We're going to make this all make sense for you. Hey, Amber, how you doing? Hello, everybody. Again, we'll go ahead and get started here in just a moment. I'm going to let some more people join just so we can, so people don't get a little left behind when we start the questions. But thank you guys so much for being here. If you guys were interested in tutoring, you can send me a DM via Service Plus, and the replays will be on YouTube afterwards as well. Hello, Sylvia. Hello, how you guys doing? Hello. We'll go ahead and get started with the questions here in just a moment. It's nice to see you guys. I hope you guys are having a fantastic weekend. How's everyone doing today? Super excited to go over these questions with you guys today. We're doing some anatomy and physiology, and there's a little bit of pharmacology sprinkled in today. Hello, Bassatron. Hello, how you doing? I love the name. That's so awesome. Take a sip of my drink, and then we'll go ahead and get started. Alrighty. So, quick introduction to who I am. Hello. My name is Ollie. I go live multiple times a week here on TikTok, covering mostly anatomy and physiology. We're doing a little bit of pharmacology today with some musculoskeletal system and cardiology and cardiovascular pharmacology. And normally we go live at 3:30. Next week, the live, I have to check my schedule for Monday. Let me check. I'll have my Google Calendar up. Let me see. The live stream, again, is going to be on Monday. Oh my goodness. On Monday at 2:30 p.m. EST. We're going over all of A&P 1 for the HESI and TEAS. But welcome, my name is Ollie. I have my master's degree in molecular medicine, and I go live multiple times a week covering anatomy and physiology. We'll go ahead and get started with number one. Number one, the structural unit of compact bone responsible for weight bearing is what? A, B, C, or D? If you're new here, what you just do is you comment the letter that you think the correct answer is, and then we'll go over it together, see why it's right, see why it's wrong. But hello, everybody. Welcome in. Happy Saturday. How's everyone doing? Hello. How's everyone doing? I'd appreciate it if you guys gave the live stream a like. It'll just get it out to more people so we can help as many people as possible on their upcoming anatomy and physiology exams. But just comment A, B, C, or D, whatever you guys think the answer choice is. Hello, everybody. You guys are awesome. Thank you guys so much for being here. We're on number one. The structural unit of compact bone responsible for weight bearing is what? A, B, C, or D? What do you guys think? So number one, the answer is C. It is an osteon. The osteon is also known as the Hoffersian system. These are they're kind of cylinder-like. The structure in compact bone, it's going to bear weight and withstand stress. It has the concentric lamellae that surround a central Hoffersian canal containing your blood vessels and nerves. Number two, what drug class inhibits osteoclast-mediated bone resorption? A, B, C, or D? Trabeculae is found in spongy bone, so not primarily weight-bearing. Osteocytes are mature bone cells, and lacunae are the small spaces that are going to hold or house the osteocytes. All right, makes sense? Does that help with everybody? But welcome everybody that just joined. Welcome. My name is Ollie. I go live multiple times a week covering A&P. Today we have a little bit of pharmacology sprinkled in today. Also, I'd appreciate it if you guys gave the live stream a like. The more that you guys do like the live, the more that it gets out to as many people as possible, so we can help as many people as possible with A&P and pharmacology and whatnot. But we're on number two. What drug class is going to inhibit osteoclast-mediated bone resorption? A, B, C, or D? I'll give you guys a moment to answer. And number 2, which drug class inhibits osteoclast-mediated bone resorption? The answer is B. It's bisphosphonates. So these are going to bind to your bone material. I'm sorry, not material, mineral. What this does is this is going to inhibit your osteoclast activity. Calcitonin also inhibits osteoclasts, but it's less potent. Number 3, vitamin D deficiency in adults can lead to what? A, B, C, or D for this one. Thank you guys. We're at 500 likes on the live already. Thank you guys so much. I appreciate it. You guys are awesome. Thank you guys for the follows as well. It's always nice to see new faces, but it's nice to meet you guys. I'm Ollie. If you're new here, I have my master's degree in molecular medicine. Again, I'll be going live multiple times a week. The next live will be Monday at 2:30 p.m. Eastern Standard Time. Number 3, the answer is C. It's osteomalacia. So vitamin D deficiency will lead to the softening of bones, which is osteomalacia. This is due to essentially an impaired calcium absorption, and as well as its mineralization. Jeez, my eraser really is like acting up lately. Number 4, what type of muscle fiber is fatigue resistance? And it's going to primarily rely on aerobic metabolism. Which one was that going to be? Hey, Beat-Ups, how you doing? It's good to see you. Happy Saturday, guys. Hello, hello. Thanks for being here on a Saturday, guys. I appreciate it. You guys are awesome. I appreciate you guys being here. Hey, Elevate. Alrighty, number 4, A, B, C, or D. The answer here is going to be B. They are going to be our slow oxidative, slow twitch, so type 1. They have high mitochondrial content. They're going to rely on oxidative phosphorylation, and they're going to resist fatigue. Number 5, which drug acts as a depolarizing neuromuscular blocker? A, B, C, or D? A, B, C, or D? As before we move on to the next page, also if you're interested in tutoring, or I have notes on my profile, it's in my TikTok bio. They're from whenever I was in the class for anatomy and physiology. If you have any questions about that, you can send me a direct message, or if you're interested in tutoring. Number 5, the answer is A. Succinylcholine. This is going to essentially mimic acetylcholine at the neuromuscular junction. What this is going to cause is a persistent depolarization and paralysis. Number 6, toxin prevents muscle contraction by blocking the release of what? What is this going to block the release of? What gets released at the neuromuscular junction? A, B, C, or D? What do you guys think for that one? We're also at 1.3 thousand likes on the live. Thank you guys so much. I appreciate it. The more that you guys do like and share the live, the more that we can get this out to as many people as possible. So I do appreciate it when you guys do like the live stream. We're on number 6 now if you're just following along, which the answer is acetylcholine. Acetylcholine. So this is going to cleave the snare proteins, preventing acetylcholine from getting released at the neuromuscular junction. This is essentially what is going to cause a bit of what's called a... I don't know why it's doing this. A flaccid paralysis. Number 7, which hormone increases serum calcium by stimulating our osteoclast activity? A, B, C, or D? Thank you guys so much for following and for sharing and for liking the live. I appreciate it. I have no idea why recently my eraser, now it did it. Sometimes it doesn't erase, and I don't know why. Number 7, I know GoodNotes has been really throwing the monthly subscription in my face. I don't know if they're trying to get me to subscribe. because I bought this in like 2019, so I've had the app for a long time. But number 7, which hormone is going to increase serum calcium by stimulating osteoclast activity? The answer is B. It is our parathyroid hormone, some of you may know as PTH. Parathyroid hormone is going to stimulate osteoclasts to reabsorb bone, releasing calcium into your bloodstream. Calcitonin would do the opposite. It's going to lower calcium. Vitamin D would increase absorption from your gut. And then aldosterone is going to be for sodium. Number 8, Nicotinamide is going to work by inhibiting what? A, B, C, or D? A, B, C, or D. Thank you guys so much for joining the live today. Happy Saturday, everybody. Welcome in. My name is Ollie, by the way. Thank you, Speaker, for the finger hearts, 11 finger hearts. Thank you for the gifts. I appreciate all the support today, guys. You guys are incredible. Thank you all so much. We're at 2.6 thousand likes on the live already, guys. It's insane. Thanks for the follows as well. Number 8 is D. This is rankle and osteoclast activation. So this medication is what is known as it's a monoclonal antibody against our rankle, or RANKL, preventing osteoclasts from maturing and bone resorption. Number 9, which drug is going to provide a rapid anti-inflammatory relief in acute gouts? A, B, C, or D? What do you guys think for that one? Just comment A, B, C, or D. Thank you, for the roses. I appreciate you. Thank you. You guys are awesome. And thank you for the finger heart as well. You guys are absolutely fantastic. I appreciate all of you so much. We're at 3,000 likes now, guys. That's awesome. Thank you all so much. Awesome. Thank you for the tiny diny. I appreciate it. Number 9. The answer is B. It's colchicine. Colchicine is going to reduce neutrophil migration and inflammation during acute attacks. So that is why. So again, going to reduce our neutrophil plus our inflammation. Number 10, chronic prevention of gout attacks is best achieved with chronic. So again, we were talking about acute. Now we're referring to chronic prevention, A, B, C, or D. Absolutely fantastic. It is allopurinol. I saw a lot of C's there. That was absolutely correct. Allopurinol is going to inhibit, thank you, Rebecca, for the rose. It's going to inhibit our xanthine oxidase. What this does when we inhibit this, this is going to lower our uric acid. Hold on one sec. I get that right? Yes, lowering your uric acids. That's going to prevent attacks. Number 11, which joint disease is primarily autoimmune and it involves pannus formation? A, B, C, or D? Thank you guys so much. Thank you, Sydney, for the gifts. Thank you guys so much for the follows and for sharing the live. Also, all of my A and P notes from whenever I was in the class. If you're new here, my name is Ollie. I have my master's degree in molecular medicine. I go live multiple times a week covering A and P. We have some pharmacology sprinkled in here today. But all my notes are available on my website. It's linked in my TikTok bio. And if you would like to get the questions, essentially you get this exact test. It's the blank version of it, and it'll have the answer key at the end. You can go through and do it on your own. I give it to the sub community. Once you join, just send me a DM letting me know that you joined, and then you will get the test after every live. Number 11, the answer is A. It is rheumatoid arthritis. Rheumatoid arthritis is autoimmune. Synovial inflammation forms pannus, which is going to lead to a bit of a destruction of your joints. Number 12, methotrexate is best classified as a what? What is it best classified as? A, B, C, or D? But welcome everybody that just joined the live. Hello. My name is Ollie. I go live multiple times a week covering mostly anatomy and physiology, but we do some other topics as well. Today we're sprinkling a little bit of pharm. Excuse me, I got the hiccups. I always get the hiccups whenever I live stream after I talk like so much. We're on number 12. Thank you also for 3.2 thousand likes. I appreciate you guys so much. You guys are awesome. Number 12, methotrexate is best classified as, it is B. DMARD. This is a disease modifying anti-rheumatic drug. So methotrexate is going to reduce immune-mediated joint damage over time. So again, we're going to reduce immune-related joint damage. Number 13, tumor necrosis factor inhibitors are used to treat what? TNF inhibitors. What are they used to treat? A, B, C, or D? Thank you guys so much for the follows as well. You guys are awesome. Thank you for being here on a Saturday. I appreciate you spending your Saturdays with me, so I appreciate it. Thank you guys so much for all the support and all the likes today, all the follows and all the participation. I hope this is helping you learn a little bit more about your A&P and some of your pharmacology. We've been going over these topics a lot during the lives during last week. So hopefully this more in-depth pharmacology one is the information we went over is going to help with this a little bit more today as well. But TNF inhibitors are used to treat, the answer is C, it's our rheumatoid arthritis. TNF inhibitors are going to inhibit our pro-inflammatory TNF alpha, which is going to reduce our rheumatoid arthritis. A, B, C, and D, it's not commonly used for these. Number 14, which drug reduces the risk of vertebral fractures by mimicking estrogen activity in bone? A, B, C, or D? A, B, C, or D? Awesome, guys. You guys are incredible. 3.4 thousand likes. Oh my gosh, thank you guys. There's over 500 of you in here now. Hello, everybody. Welcome. My name is Ollie. I go live multiple times a week to teach A&P and some other topics as well. We're on number 14. The answer is B. Oop, I used my red pen. Raloxifene, or SERM. So this is going to selectively activate estrogen receptors in bone. It's going to reduce the resorption. Number 15, osteoarthritis differs from rheumatoid arthritis. Again, so this is rheumatoid arthritis. I just abbreviated to save myself some time, but I'll write it out here while you guys are answering number 15. It's rheumatoid arthritis. Number 15, A, B, C, or D. What do you guys think? We're also at 4.1 thousand likes. Yep, I can make a video on the MCAT study tips. Yeah, absolutely, 100%. If you guys have any video requests or anything like that, or any requests in general, you can send them via Service Plus. This is how you do it. If this goes away, it's in the bottom left corner there as well. Number 15, the answer is A. Cartilage degeneration without autoimmune panis. So osteoarthritis is essentially what the difference is. So we'll put OA. So OA and RA. This is like wear and tear. And this is mainly going to be autoimmune. That's really the key difference. Number 16, which enzyme does allopurinol inhibit? A, B, C, or D? Thank you guys so much for the follows. It's nice to meet you all if you're new here. Welcome. The replay of this will be on YouTube later. But number 13 was C. We're on number 16. What enzyme does allopurinol inhibit? We talked about it a little bit earlier in the live. Number 16. The answer is A. It's xanthine oxidase. So xanthine oxidase is going to convert. What this does is this is going to convert xanthine to uric acid. Allopurinol is going to inhibit this, reducing the formation of our uric acid. Number 17, Entrectinib acts directly on skeletal muscle by inhibiting what? A, B, C, or D? A, B, C, or D. I give the questions out, so it'll be a blank copy of the test, and the answer key will be at the end. I give that out to the sub community here on TikTok. As soon as I can put the notification for it, I'll absolutely do so. But welcome, everybody. Number 17, the answer is C. With calcium release from the sarcoplasmic reticulum. This is going to block our ryanodine receptors. What this is going to do is this is going to reduce our intracellular, I'm going to put intracellular, calcium, and our contraction. Number 18, what structure marks the boundaries of a sarcomere? A, B, C, or D? What structure is going to mark the boundaries? A, B, C, or D? I see a lot of perfect. Well, welcome, Farm Ds. I was a pharmacy tech for 4.5 years, so I know pharmacists work very hard, so that's awesome. This is not for the TEAS. Nope, this is kind of just a general A&P, general pharmacology. No exam is being prepared for here today. Just kind of going over what a lot of people have been requesting. We're on number 18 now. What structure marks the boundaries of the sarcomere? The answer is C. It is the Z line. The Z line defines the ends of a sarcomere, and they're going to also anchor your actin filaments. Number 19, corticosteroids delay tendon and ligament healing because they what? A, B, C, or D? Also, if you were interested, someone asked about getting the questions. I give the questions out to the sub-community. So basically, it's going to be the blank version of this. It's going to be the exact same test, blank version, answer key at the end. So you can print it out, do it on your own, get some practice on your own. We can't live without our text. I know, I don't do it anymore, but yeah, no, it was a rough job. I know pharmacists definitely put in their overtime mentally and physically. But number 19, the answer is C. It's going to decrease our collagen deposition. Steroids reduce fibroblast activity in collagen synthesis. This is going to slow down your connective tissue repair. I just finished AMP2 with an A-. I have no idea most of these. That's okay. So some of these are pharmacology, so you might not have taken the class yet. Again, we're trying to use some of that AMP1 and AMP2 knowledge to kind of elaborate a little more and relate it to how pharmacology works on our body's normal physiology and its anatomy as well. Number 20, statins are going to cause musculoskeletal side effects such as what? What can they cause? A, B, C, or D? For number 20. Thank you. There's over 500 of you in here now. Welcome in. If you're new here, it's nice to meet you. My name is Ollie. I just recently got my master's degree in molecular medicine, and I did my undergraduate degree at William & Mary. I did that in biomed and kinesiology, and I teach anatomy and physiology multiple times a week on TikTok Live. Next live will be it'll also be in my TikTok profile. It'll be at 2:30 p.m. Eastern Standard Time on Monday. I'll actually make a video tomorrow morning. It'll go over the schedule for the week. Number 20, the answer is B. It's myopathy and muscle pain. Statins interfere with your muscle cell metabolism, can cause basically our myopathy and muscle pain. And I have about 10 true or false questions here before we move on to some cardiovascular system. Number 21, true or false, bisphosphonates increase osteoblast activity directly. True or false? True or false? You can just put T or F or true and false. William & Mary for the win. Love Williamsburg. That's awesome. Thank you, Julie. Thank you. You're taking A&P yourself, taking A&P2 this fall. Pray for me. Of course, Diego, and of course, Kylie. That's awesome. Good luck this fall. You guys are going to crush it. Also, 5.8 thousand likes on the live today, guys. Thank you so much. So this one, bisphosphonates increase osteoblast activity directly. This is going to be false. What would make this a true statement? So these are going to inhibit osteoclast activity. Any osteoblast stimulation there would be indirect. Number 22, we have another true or false. Again, we have 10 true or false questions. Slow twitch or type 1 fibers are rich in mitochondria. True or false? And again, hopefully these true or false questions, they're kind of related to kind of what we covered in the other questions. So hopefully you can use those questions to learn and answer these ones. So that's kind of the intent with the way the questions are structured. To make sure that when we were talking, I hopefully elaborated on enough that you could remember and are able to answer future questions. So take a question, learn from the question to be able to answer another question. Number 22, slow twitch or type 1 muscle fibers are rich in mitochondria. This is absolutely true. They are rich in mitochondria because they need to have a higher oxidative capacity, giving them resistance to fatigue. Number 23, true or false? Succinylcholine produces paralysis by persistent depolarization of the motor end plate. Is this one true or false? True or false? I'll give you guys a moment to answer. Thank you guys so much for the follows as well. I appreciate it, guys. All of my notes for A&P as well, those are linked in my TikTok bio. Also, if you're interested in any tutoring, please let me know. This is the best way to get in contact with me or via email. Number 23, the answer is true. So this is going to cause phase 1 block at our neuromuscular junction. Number 24, true or false? This toxin is going to increase release of acetylcholine at the neuromuscular junction. True or false? Again, increase it. Is it going to increase the release? True or false? Yep, how do you subscribe? It's down in the bottom left corner. It'll say subscription or it'll say Service Plus. You can get in contact with me with Service Plus. Data integration, not a nurse. Why are all you A&P peeps ending up on your page? I don't know, but I'm glad you're here. We definitely need some data integration, especially in our sciences. But number 24, the answer is false. This is going to block the release of acetylcholine at the neuromuscular junction. 25, true or false? Calcitonin lowers blood calcium by inhibiting osteoclast. True or false? True or false? True or false? It's awesome. If you're new here, welcome. It's nice to meet you all. I'm Ollie. I go live multiple times a week covering A&P and a little bit of pharmacology as well. But true or false? The answer is true. Calcitonin will lower blood calcium levels by inhibiting osteoclast activity. Is going to oppose, my voice cracked a little bit, your parathyroid hormone. Number 26, true or false? Colchicine is useful for long-term prevention of gout. True or false? I'll give you guys a moment to answer. I'm going to take a sip of my drink real quick. My throat's still drying up a little bit. This is false. Colchicine is more for acute. Long-term is allopurinol. Number 27, true or false? Osteoarthritis is characterized by joint space narrowing and osteophyte formation. True or false? This is more of a radiology question, a little bit. If you're a radiologist or a radiology student. I'm sorry, why did I say AB? I'm so used to saying A, B, C, or D. True or false? The answer is true. These are your classic findings on a radiographic finding, basically. Number 28, true or false? Rheumatoid arthritis commonly presents with asymmetric large joint disease only. Oh my goodness! I don't have to drink. That'd be a fun drinking game. Every question you get wrong, you take a drink. If you went to my live streams, I don't encourage it, but that would be funny. The answer is false. They are going to refer to symmetric small. So symmetric small joints. It's not limited to large joints. Number 29, true or false? Dantrolene is the treatment of choice for malignant hyperthermia. True or false? True or false? Also, thank you guys for 6.7 thousand likes on the live. You guys are awesome. The more that you guys do like and share the live, the more that we can help as many people as possible. The answer here is true. This is absolutely correct. Dantrolene is going to block, again, remember we block the SR release of our calcium, which is going to prevent our sustained muscle contraction. Number 30, true or false? Vitamin D deficiency in children results in rickets. True or false? True or false? What do you guys think? Thank you guys. We just hit 7.1 thousand likes on the live already, guys. You guys are awesome. Thank you, Care for the Rose. I appreciate it. Thank you guys so much for being here. Thank you for spending the Saturday with me. Number 30, it's true. So vitamin D deficiency will cause a defective mineralization in growing bones. It's going to result in rickets in children. All right, so moving on, we have some cardiovascular questions. What chamber of the heart is going to pump oxygenated blood to the systemic circulation? It's proving that exotic statewide on descriptive words only. Yeah. But we're going to move into some cardiovascular. Also, like I mentioned before, if you would like to get a blank copy of the test, again, it's the same test, blank copy. It has the answer key at the very end. You can go through, print it out, do it on your own. You just join the sub-community. Once you join, just send me a DM letting me know that you did join. Also, you can find the replay on YouTube. It's linked in my bio, as well as my A&P notes. Those are also linked in my bio. I got an A in the class, 100% on my finals. I just recently graduated with my master's degree in molecular medicine. It's very nice to meet you if you're new, and welcome back if you've been here before. It's nice to see everybody on a Saturday. But number 31, the answer is D. It's the left ventricle. The left ventricle pumps blood, which is oxygenated, into systemic circulation. It's going to pump it into the aorta and then out to the rest of the body. Number 32, cardiac output is the product of what? What is the correct formula? A, B, C, or D. Thank you so much for the follows as well. It's nice to meet everybody. Thank you guys so much for being here. The right atrium is going to put into the right ventricle. The right ventricle is going to pump deoxygenated blood that gets returned from the body, and it's going to pump that to the lungs. It's going to come back to the left atria and then to the left ventricle and to the body. The best way to practice blood flow, I truly believe, is straight up just drawing out your heart. I draw 4 boxes for the chambers of the heart, and then you draw your inferior vena cava and the aorta, things like that, and then you go through a label and practice drawing blood flow through. That's how I always did it. But number 32, the answer is A. It's our stroke. Cardiac output is the result and product of stroke volume times the heart rate. So the volume of blood pumped per beat times the beats per minute. Number 33, the plateau phase of ventricular action potential is due to what? A, B, C, or D? A and D are the same. Oh, oops. They were not supposed to be. Sorry about that. They're not supposed to be. I'll fix that before I send that out. But number 33, the plateau phase of ventricular action potential is due to what? A, B, C, or D? Yep, D was the same thing. My bad. Number 33. Answer is C. It is a calcium influx. So what the normal action potential kind of looks like is kind of like this. It kind of looks like this. This plateau here is due to the calcium influx. Number 34, the class 3 antiarrhythmic drugs are going to primarily block what? Antiarrhythmic. Thank you guys so much for the follows as well. You guys are awesome. It's nice to meet you all. Thank you guys so much for being here. We're doing a little bit of we're doing A and P. We're doing some pharmacology as well. Number 34, the answer is A. They're going to block potassium channels. So these drugs, an example is amiodarone, sotalol, other ones as well, are going to prolong, essentially, prolong repolarization by blocking the calcium channels. What this does is this is going to increase action potential duration. Number 35, the stimulation of beta-1 adrenergic receptors in the heart is going to cause what? A, B, C, or D? A, B, C, or D? What do you guys think for this one? That's awesome. Number 35. The answer is B. Increased heart rate and contractility. So beta-1 receptors are going to increase your CAMP, which is going to enhance your calcium entry and myocardial contractility. Number 36, beta blockers are going to reduce blood pressure mainly by what? What do these mainly do? A, B, C, or D? A, B, C, or D? What do you guys think? Thank you guys also for 10,000 likes on the live. I appreciate it. You guys are awesome. The more that you guys do like and share the live, the more that we can get this out to as many people as possible to help as many people as possible on their exams this fall and everything like that. I know a lot of people, I don't know if you're in class right now or you're starting class soon, but good luck. Definitely let us know when you're starting in the comments. That'd be awesome. But number 36, the answer is B. It's going to be decreasing heart rate and contractility. So beta blockers are going to lower our cardiac output, reducing our blood pressure. Beta blockers actually decrease your renin release, not increase it. Number 37, the renin-angiotensin-aldosterone system. This also gets abbreviated as the RAAS. This is going to be inhibited by what? What does this get inhibited by? What does this get inhibited by? A, B, C, or D? Thank you guys so much for the follows as well. I appreciate you guys being here. You guys are awesome. The answer is A. ACE inhibitors and ARBs. So ACE inhibitors block the conversion of angiotensin 1 to angiotensin 2. ARBs are going to block angiotensin 2 receptors. Number 38, angiotensin 2 causes what? What does angiotensin 2 cause? A, B, C, or D? Also, if you'd like to get a blank copy of these tests and the answer key at the end so you can do them on your own outside of the live stream, you just join the sub-community. Once you join, just send me a DM. Otherwise, they are available on YouTube, and then all my notes are available on my website, and everything is linked in my TikTok bio. But number 38, angiotensin 2 is going to cause answer choice B, vasoconstriction and aldosterone release. Angiotensin 2 is going to increase your systemic vascular resistance and stimulate aldosterone for the retention of sodium. So again, remember, that aldosterone is going to retain sodium, and water follows sodium. So indirectly with water. Number 39, the baroreceptor reflex is primarily located where? Where's the location of the baroreceptor reflex? A, B, C, or D? I teach on YouTube for free. Yep, I absolutely do. So every replay of every live stream I do is on YouTube that you can watch back. We still got it. That's awesome. That's awesome, Anna. That's fantastic. Number 39, the answer is B. It's in your carotid sinus and your aortic arch. So what baroreceptors are, they detect stretch. That stretch is what's going to help determine what your blood pressure is at, basically through sympathetic or parasympathetic output. And where is pressure the highest? In your aorta, because that's where it's getting pumped from the left ventricle. Number 40, when antihypertensives lower blood pressure, baroreceptors would what? So when antihypertensives lower blood pressure, baroreceptors are going to what? A, B, C, or D? What are they going to do? Double D 22300. I don't miss these days. I don't blame you. Nico Blisgy, I love it. ER nurse here. That's awesome. That's awesome. Welcome, ER nurse. Great refresher. I'm so glad this is a good refresher. Thanks for being here and participating. Also, thank you guys for 12,000 likes. The answer is A. So when an antihypertensive is going to lower your blood pressure, baroreceptors are going to increase sympathetic output. An example of this is reflex tachycardia is going to occur to restore blood pressure by increasing the heart rate and vasoconstriction. I'm dancing right now. That's incredible. That's so funny. Number 41, which phase of the cardiac cycle corresponds to ventricular contraction? Again, ventricular contraction. A, B, C, or D? Nursing instructor here, actively stealing your questions. Oh my goodness. Well, I'm glad you think they're good for your whenever you're going to instruction. Number 41, which phase of the cardiac cycle is going to correspond to your ventricular contraction? Feel free, if your students want some extra practice, to send them to the live streams. I'd appreciate it. But number 41, which phase of the cardiac cycle is going to correspond to ventricular contraction? It's A, it's systole. Diastole is going to refer to relaxation or filling. Also, when we're talking about contraction, we're referring to ejection of blood as well. Number 42, diduction is going to increase contractility by inhibiting what? A, B, C, or D? Jackson, what is it going to be? A, B, C, or D? Awesome. We're at 13.7 thousand likes. Thank you guys so much. I appreciate it. You guys are awesome. Number 42. It's going to increase contractility by inhibiting A. It's the sodium-potassium ATPase pump. So the inhibition, when we inhibit this, what this causes, it's going to increase our intracellular sodium. What that causes is a reduced exchange of sodium for calcium, and then what that does is you have increased calcium in the cytoplasm. I don't know why I won't erase. Giving it a stronger contraction. Alrighty. Hopefully that made sense. Number 43. Butamine is a what? A, B, C, or D? What is this? A, B, C, or D? I'll probably move this over a little bit here. Tried to keep it out of the way in the next question, but I don't think I have to write too much. But thank you guys so much for being here on a Saturday. Happy Saturday. I hope you guys are doing your Saturday in a fun and relaxing way. Why is the same answer on there twice? Oh, man. My bad, guys. My bad. Same thing. That's a user error. Number 43. Yep, do I go live often in practice? Yep, I go live 4 times a week every week, covering anatomy and physiology and other topics as well, like we're sprinkling in some pharmacology today as well. Number 43, the beginning is a what? The answer is C. It is a beta-1 agonist. Beta-1 agonists increase heart rate and contractility, mostly used in something like acute heart failure. Oops, and my question got cut off down here. Again, and if I have a little mistake here like that, if I do send the questions out, I'm going to fix that before I send it out. Number 44, which coronary artery supplies the majority of the left ventricle? Which one is that going to be? The left ventricle. And again, the question here for number 46 is cut off, but I'll fix that before I send it out. But again, if you would like to get these questions and you'd like to practice them on your own, you just join the TikTok sub-community. Once you join, just send me a DM letting me know. You're driving me to the nail salon. That's awesome. That's so funny. You guys are killing me today. You guys are hilarious today. Number 44. The answer is B. So the coronary artery that supplies the majority of the left ventricle is the LAD, the left anterior descending artery. It supplies the anterior wall, the septum, and the apex of the left ventricle. Number 45, nitrates relieve angina by what? How do nitrates relieve angina? A, B, C, or D? And again, I apologize about number 46 getting cut off. I'll fix that before I send out the PDF. Sometimes it's really weird because I'll look through it and sometimes it like matches up because I do this in Google Docs. And then when I import it to like a PDF and put it on my iPad, it does that for some reason. But number 45, the answer is B. It is by decreasing preload and causing venodilation. So venodilation, what this does is this is going to reduce your left ventricle end diastolic volume. What that does is going to lower your myocardial oxygen demand. Sorry, I gotta kind of get it in there. Number 46, again, apologize about the cutoff. But number 46, which class of drug is contraindicated with nitrates, essentially due to the risk of severe hypotension? Number 46, again, number 46 is here, and the answer choices are down here. I apologize about that. I'll fix it before I send it out. And I'll read your questions as well. Valerie, thanks for the predate anatomy quiz. To help me show. That's awesome, Anna. Thanks for being here today. I appreciate it. Hope to see you in more live streams. I know these answers because I have heart failure. Well, that is not a good thing. But at least you know the answers to the questions. This ANP2. So a little bit of ANP2. Yeah, we did musculoskeletal, and then we're doing cardiovascular, and then pharmacology sprinkled in. So a little bit of everything today, in a sense. But number 46. The answer is C. It's PDE5 inhibitors. An example of a PDE5 inhibitor is sildenafil, or similar drugs. And nitrates are going to essentially cause a profound vasodilation, which is like a life-threatening hypotension. Number 47, which combination is first line for systolic heart failure, A, B, C, or D? Thank you guys so much for 15.7 thousand likes on the live. That is insane, guys. You guys are incredible. Thank you guys so much for your support today. You guys are incredible. So what days do I teach ANP1? So ANP1 this week, we're doing all of ANP1 on Monday. This week it's at 2:30 p.m. Eastern Standard Time. I'm actually putting out a video tomorrow morning. It's going to go over my entire schedule for the week. But at the end of the live stream today, I'll give you guys the schedule for next week on the live. And there will be a video as well in case you can't stick around to the end. But number 47, if I didn't scroll down enough. Which combination is the first line for systolic heart failure? The answer is B. They are ACE inhibitors, ARNI, beta blockers, and diuretics. They're going to target your RAAS, your sympathetic overactivity, and your fluid overload. That is why. Number 48, statins lower LDL cholesterol by inhibiting what? What do statins inhibit? Yeah, we'll include a little bit of chemistry questions on Monday, just because chemistry is a part of ANP1. Number 48, statins lower LDL cholesterol by either A, lipoprotein lipase, B, CETP, C, PC, SK9, or D, HMG coenzyme A reductase. Number 48, the answer is D. It's our HMG coenzyme A reductase. So essentially, inhibiting this is going to reduce cholesterol synthesis. It's going to cause the upregulation of your LDL receptors. Speaking of PCSK9 inhibitors, they lower cholesterol by what? A, B, C, or D? Hey, Clarissa, how you doing? Good to see you. Can barely see the questions. Can everyone see the questions okay? Before I move on. I just want to make sure everyone can see. Yes, yes, okay. You might have to leave and rejoin if you're having trouble seeing the questions. Good evening, T. Good to see you as well. I would join. I would leave and then rejoin if you're having an issue with that. This one, A, R, and I. Whoever asked about that, these are, and then I'll give you guys the answer. Angiotensin receptor. Oh my goodness, I'm getting really annoyed with why this won't erase. If anyone knows a fix for that, please tell me, because it's getting on my nerves. It's an inhibitor. But number 49, the answer is C. They're going to prevent LDL receptor degradation. So more LDL receptors on hepatocytes results in an increased LDL clearance. So again, more hepatocyte LDL receptors results in increased LDL clearance. Number 50, the first-line therapy for essential hypertension often includes what? A, B, C, or D. And then we're going to have some more true and false questions for... sorry, I was... The chat. Keyboard thing makes questions invisible. Okay. Well, can everyone see the question that we're on number 50? Have fun testing. Awesome. Thank you for being here. Great super. It's nice to see this again. That's awesome. Thank you, Clarissa. It's good to see you again. Cataracts in my eyes. Okay. Gotcha. Could not have known that. But what are these questions targeted for? Just general A&P and pharmacology. No specific exam. Just for your review, just to get you prepared for the semester. Give me 1 second. Number 50, the answer is B. Thyroid diuretics, ACEIs, ARBs, or CCBs. These are the evidence first-line anti-hypertensives. Now we have some more true and false questions. They're kind of based on the previous questions that we went back a little bit, just to kind of cover the same concepts in a way. But number 51, true or false. Again, I have true or false questions. Heparin works by enhancing antithrombin 3 activity. True or false? True or false? What do you guys think for this one? These are not necessarily for the TEAS. Monday and Tuesday will be for the TEAS. It'll be A&P. A&P 1 on Monday, A&P 2 on Tuesday. The answer is true. This is true. Number 52, true or false? Warfarin acts by inhibiting vitamin K-dependent clotting factors 2, 7, 9, and 10. True or false? True or false? The answer is true. Number 53, true or false? DOACs, this will also be the direct oral anticoagulants, directly inhibit platelet aggregation. True or false? Are they going to inhibit platelet aggregation? True or false? So this is actually false. These are not going to inhibit platelet aggregation. They are going to inhibit thrombin or factor 10A. So again, they do not directly inhibit platelet aggregation. They're going to inhibit our thrombin or factor 10A. Number 54, true or false? Aspirin irreversibly inhibits our COX, decreasing thromboxane A2. Is this true or false? True or false? Platelet aggregation, it's important for clotting, yes, but it's different from the coagulation cascade. Alrighty. Number 54, the answer is true. So these are going to reduce thromboxane A2 platelet aggregation. Number 55, clopidogrel is a P2Y12 receptor agonist used as an antiplatelet agent. Is this true or false? Give you guys a moment to think about it. Also, thank you guys. We're almost at 22,000 likes on today's live. You guys are incredible. Thank you guys so much. We have up until 60 questions here. And if you would like to get a blank copy of this exam and you would like to get the answer key at the end so you can do it on your own, you just join the sub community and you tell me, you let me know when you join, just send me a DM, and then you'll get the test after every single live. I go live 4 times a week. This is false. It is not an agonist. It is an antagonist. Number 56, the initial emergency treatment for myocardial infarction includes morphine, oxygen, nitrates, and aspirin. True or false? Got a couple more questions here for you guys. Thank you guys so much for the follows today as well. It's nice meeting all the new people. Welcome back if you've been here before. You guys are crushing the questions today. I'm so proud of you guys. It's awesome. It makes me so happy when I see you guys getting them right. But this is going to be true. Number 56. Number 57, true or false? The AV node is normally the primary pacemaker of the heart. True or false? The AV node is normally the primary pacemaker of the heart. This is false. The SA node is the primary pacemaker of the heart. Number 58, true or false, adenosine slows AV node conduction and it is used for supraventricular tachycardia. True or false? Thank you so much, Blue, for the rose. Thank you guys so much for the gifts and all the support on today's live and all the likes and everything. I appreciate all the follows, for all the subs as well. You guys are awesome. Adenosine slows AV node conduction is used for supraventricular tachycardia. This one is true. Number 59, class 1 antiarrhythmic drugs block potassium channels. True or false? True or false? Scroll. Yep, absolutely. Sorry about that. Number 59. Answer is false. Class 1 antiarrhythmic drugs block potassium channels. It's false. They block sodium channels. Last question here, everybody. If you've made it the entire live, thank you so much for being here. It was fantastic. But number 60, true or false? Class 4 antiarrhythmic drugs are calcium channel blockers. This is true or false? But seriously, thank you guys so much for being here. If you're new here, welcome. My name is Ollie. I do go live multiple times a week covering anatomy and physiology. I'm going to write down my schedule for the week. I'm going to make a video and post it tomorrow in case you can't stay here. You got here right for the last question. Oh my goodness. Well, at least you got here at some point, Eve. It's good to see you. But number 60, the answer is true. This is true. Thank you guys, seriously. End time 3 a.m. Oh my goodness. That is so late for you. What are you doing up at 3 a.m.? But anyway, the schedule for next week, let me pull my Google Calendar because I just put it in my Google Calendar today. All right, so we have a live stream on Monday, Tuesday, Thursday, and Friday this week. Tuesday is a super special one, and I'll go over that in just a minute. But Monday, it's going to be a little earlier on Monday because I have a meeting at 4. So we're going to do 2:30 p.m. Eastern Standard Time on Monday. It's going to be A&P 1. A&P 2 will be on Tuesday. This is going to be at 3:30 p.m. Eastern Standard Time. This one's a super special one, mainly because I think we're doing a little thing with TikTok on Tuesday, so that'll be fun. But we're doing A&P 2. But the day, Thursday, this will also be 3:30 p.m. Eastern Standard Time. And then Friday is going to be 1:30 p.m. Eastern Standard Time. So these are the 4 live streams for next week. I don't know if you want to take like a screenshot. These topics are TBD, kind of just based on what you guys send. We'll kind of feel like going over. But Monday will be A&P 1, Tuesday A&P 2, Thursday and Friday, those are going to be TBD, kind of random things. Whatever gets requested the most. Like I mentioned, if you want to get the questions, they are available by joining the TikTok sub-community here. This is our community here on TikTok. Once you join, send me a DM. This is how you join. But thank you guys so much for being here today. I'll stick around for a couple extra questions. I'll leave this up here as well. Right now, this is my full-time job, tutoring. I do have tutoring available. It is on my website. It is while I apply for my PhD. But who knows? This has been a lot of fun. I enjoy doing this. I have not been in AP for 28 years. Oh my goodness, welcome back. I need tutoring. All right, Lena, send me a DM and let me know, or an email. It's on my website. Basically, the times and my availability is listed on my website. I'm pretty sure I've almost out of slots for this week. And then tomorrow or Monday, so from like this week, from the 25th on to like the 30th and 31st, I'm pretty sure I only have like a couple slots open. But the first week of September, I'm going to release my availability probably tomorrow or Monday, in case anything this week doesn't work for you. But awesome. And then I'm going to stick around and questions. Awesome. Perfect. What's my website? It's Medzeg. It's linked in my bio. Or you can send me a DM. It's in the bottom left corner there. What's your favorite topic to teach? What's my favorite topic in anatomy? If you're talking about anatomy, hopefully. But my favorite topic to teach in anatomy, that's kind of a tough one. I really, really enjoy going over the neuromuscular junction, so like muscle physiology. And I also do love cardiovascular physiology. In general, in anatomy, yeah. In general, yeah, just anatomy. That's kind of why, if you can't tell by my TikTok, I do love anatomy and physiology. In terms of my favorite specifically, I don't know about teaching, just because it is hard for students to grasp, but for me personally, one of my favorites is the endocrine system and endocrine physiology. Thank you so much, Terry, for the hand art. I loved going through the endocrine system, all the hormones and what they affect in that. It was like a fun puzzle in a way for me. I know a lot of people disagree with that, but yeah, again, there's the schedule. I'm going to flip the camera around and say hello to everybody. Hello, everybody. I don't know why oh my goodness, is my thing foggy? So sorry about that. There we go. Hopefully that's better now. But thank you guys so much for being here today. Hello. It's nice to meet you. Hopefully you can put a face with the voice from the day. It's nice to meet everybody if you're new here. I wish I discovered you when I was actually taking the class. I love the nephrology part. Yeah, no, there's definitely a fun one as well. And I'm so not sure. Is my like screen blurry for everybody? Discovered you when I was actually taking the class. I love the nephrology part. Yeah, no, there's definitely a fun one as well. And I'm so not sure. Is my like screen blurry for everybody? I feel like it is. But so sorry, I don't know why it's doing that. How often do I have the tutoring? Pretty much every day. First time here, welcome. It's nice to meet you. Pretty much whatever's available on the website is how often I'm having the tutoring. I kind of set that in advance, but I try to have stuff every day. It does get booked up pretty fast. Just because it's the start of the semester, there's more availability. But over the summer, it was like completely booked the whole summer, which is a good problem to have. Yeah. But yeah, it was awesome. First time here. Awesome. Thanks for being here. I appreciate it. Nice to meet you. I have a master's degree in molecular medicine, and I did my undergraduate in biomedical sciences and kinesiology. I was a pharmacy tech for 4.5 years, did a little bit of research, and I've been tutoring anatomy and physiology for 5 years now, almost 6 years, so about 5.5 years. And then what else? Did some pharmacology tutoring, some biomechanics. Started doing some biomechanics tutoring. And then we're also tutoring. I've been tutoring medical students as well. I have 2 medical students right now that I'm tutoring. Took kinesiology until I switched to nursing. Yes, kinesiology is a lot of fun. It was fun to have. I started kinesiology, and as I went on, I added the biomed after a year. More farm questions. Yeah, of course. Yeah, we'll incorporate some later in this week. And I'd like to make some more lecture style videos as well. I'll stick around here for another minute or two to answer some questions. I do have to get going. Thank you guys for 27,000 likes. That is insane. But if you were interested in tutoring or anything like that, or in my notes or anything like that for anatomy and physiology, you can ask me that as well via the Service Plus button. This is how you can get in contact with me. It's the only way to get this, and then my email, it's linked in my bio. Those are the only ways to get in contact with me. I don't know if you've heard from anybody else about me or anything, but those are the only 2 places that you will be able to contact me. So if you've got it from anywhere else, it's not me. But thank you. I'm taking kinesiology and anatomy for massage school. That's awesome. Good luck. Are you starting this fall? Are you currently doing it, or are you starting it this fall? Awesome. Thank you guys so much. Studying the medical steps here, amazing. Thank you, Linza. Thank you. I appreciate that. It makes my day. I appreciate all the kind words today, guys. Yes, currently. That's awesome. But seriously, thank you guys for today. Today was so much fun. Thank you for being here. On a Saturday of all days, it's insane that I think we kind of averaged 300, 400 people today, which is insane. That's 400 people are here on a Saturday. But seriously, but we definitely are going to be doing some more lecture style videos. That'll be on YouTube. It's linked in my TikTok bio. Thanks all. Yeah, thanks for Clarissa. It's good to see you again. Go to bed. I know it's late for you. It's 3 a.m. What are you doing up? To get your sleep. That's the most important. You need to log in when you first start the live. Yeah, so Monday, it will be 2:30 p.m. I'm actually going to release a video. It's going to be tomorrow morning. It'll just kind of list out the schedule. But if you go to my profile, you can put the notification bell on, or I have to set it actually, so it won't be available right away. I'm going to go in and set the schedule. So on my profile, it'll say live event scheduled at, and I believe if you click on it and register, it'll send you a notification when I go live. So it's not like every single time I go live. It's the next one that you can get notified for or something like that. I was a massage therapist 8 years ago. That's awesome, Pumpkin King. Were there any more questions here while I was sitting around here? Just any any little questions, any housekeeping questions? I have a medical terminology series going up on YouTube. I just posted the first video a week ago or so. I'll go over the one I'm recording them all tomorrow, but that'll be how was your pharmacy job? Rough. There's a reason I don't do it anymore. It's just my name. My YouTube name is Ollie Hertzig. It's available in my TikTok bio as well. Or if you want the link, just hit the Service Plus button and send it to me. I can send the link directly. Being a pharmacy tech, the job itself was fun. I think that I don't really enjoy necessarily the patient-driven workflow. Because I was interested in going to medical school for the longest time. When shadowing and driving and the pharmacy kind of burned me out with the patient care stuff. But at the end of the day, I love this stuff and I love teaching and I love the research aspect of things. So that's why we're here now. So I'd like to get my PhD. I just got my master's degree. So looking forward to it. I want to teach at a college as well. So me doing the live streams and tutoring definitely helps me do that. I love doing the live streams. They're the favorite part of my day. Have I applied? I did. So last year I did, but the programs that I applied to they lost their funding this year. So I'm going to send some emails out probably this week just to see where the funding's at, to see if it's even worth kind of putting in. It's a lot of effort to put in those applications for that. Just to see if this year is the year to put in effort for that, or maybe wait around a little bit to see what goes on. Pretty happy doing what I'm doing now. I love doing this. This is so much fun. I do have to get going, but I'll see you guys. I do have to get going. Sorry, I do have somebody at 3:15. But it was nice talking to you all. Nice meeting you all if you're new. I will be back on... Did I ever fully read my textbooks, or was it strictly skimming? Skimming before class, fully reading afterwards. I'll make a video on it. I do have to go. Thank you guys so much. You guys are awesome. Monday, 2:30, I'll put a video out tomorrow. Thank you guys so much. Love you guys.